My name is Dr. Yoshihiro Katsura, and I'm a board-certified orthopedic spine surgeon practicing in Northern California. Today we're going to talk about artificial disc replacement, which is a very powerful and promising field within spinal surgery. It's basically replacing one of the discs in your spine that has become damaged or spent with a prosthetic disc that can recreate its normal anatomy and motion. There's two main types of disc arthroplasties that are available. There's a cervical disc arthroplasty, which is in your neck, or a lumbar disc arthroplasty, which is in your low back. Today, I'm going to focus primarily on cervical disc arthroplasty. Both cervical and lumbar disc arthroplasties can be used to replace discs in the respective areas. The discs in the spine, otherwise known as the intervertebral discs, are incredible structures. They are gelatinous, very tough, puck-like structures that sit between the bones of your vertebrae. They act as cushions and also as restraints to motion, but they allow your spine to conform to a lot of different shapes and sizes, allow you to bend, twist, rotate, and they can help with absorbing shock from compression. They can help flexion, extension, so you can bend forward, and they can also help with rotation, so you can twist. A cervical disc arthroplasty consists primarily of four main components. There is a polyethylene core, which is a plastic structure that is highly durable and is very resistant to degradation. That is sandwiched between two titanium end plates that have a special coating that is designed for the bone to ingrow into it. There's typically a bearing surface within the titanium end plates that allows for easy motion and gliding. You may notice that there are little spikes on the top and bottom of the cervical disc arthroplasty, and that allows for the device to anchor into the bone itself and not become dislodged. Some devices also have a locking mechanism to keep the polyethylene core in place. With these components, the CDA can recreate typical anatomy in a spine, so bending, twisting, flexion and extension. What kind of problems require treatment with a cervical disc replacement or cervical disc arthroplasty? The most common and basic recommendation for a cervical disc arthroplasty is to treat a disc herniation causing nerve or spinal cord compression. These are problems that can be treated either with a cervical disc arthroplasty or with a more traditional cervical fusion known as an ACDF. Here's a little cartoon describing what happens in your spine when a disc herniates. As you can see, a disc undergoes degeneration and can actually protrude into the spinal canal, compressing on the spinal cord itself or the nerves. This can cause severe irritation, pain, numbness, tingling, and a host of other neurologic symptoms. Typically, spine surgeons would treat these types of problems with what's called a cervical fusion, where the disc is removed, a cage is implanted, and a small plate is attached to the front, allowing these two bones to grow together to become one bone. That's called a cervical fusion, or ACDF. But over time, we've noted some problems with cervical fusions, namely that they can cause adjacent segment degeneration, meaning that the disc above and below the spinal fusion now experience more load because of the fusion itself and can degrade at an accelerated pace. As such, the cervical disc arthroplasty was invented and introduced into the market. Cervical disc arthroplasty is a relatively straightforward procedure. It's very similar to a cervical fusion. However, there's no joining of the bones. Instead, we insert this biomechanical device that helps recreate motion once the disc has been removed and allows you to maintain your normal neck posture and physiology. So how do you perform a CDR or a spinal fusion? Both are done through what's called the anterior approach, which is an approach through the front of your neck. We call this the anterior cervical approach, cervical just meaning the neck. Here in this cartoon, we can see how that happens. A small incision is made in your neck and the neck is exposed and the bad disc is removed, following by the insertion of the prosthesis and the closure of the wound. So who should not have a cervical disc replacement? There are some common indications to perform a fusion over a cervical disc replacement. Those namely are advanced spinal arthritis, meaning you have a lot of bone spurs and degeneration in your spine. You might have a lot of neck pain, and in those cases we want to stop the motion instead of trying to recreate motion, which is usually not possible. If you have a lot of spinal deformity or spinal instability, you should not be considered a candidate for a cervical disc replacement, again because a fusion is just going to work so much better for you in those cases. There are other contraindications to cervical disc arthroplasty, but I think these are the most relevant. This is just an illustration of that concept. In this cartoon, you can see the patient not only has a disc herniation, but develops more severe degeneration with bone spurs on the anterior and posterior aspect of the vertebral bodies. In this case, there could be some spinal instability and deformity as well. Putting a disc arthroplasty device in there can result in continued pain and continued issues and ultimately failure of the device. Instead, most times we as spine surgeons elect to perform a cervical fusion, clean out all the bone spurs aggressively, perform a wide decompression, and fuse, and that works very, very well. There are some other issues with cervical disc replacement, namely that they can go on to autofusion, which I'll explain in a cartoon, and also implants can experience instability because unlike a fusion, they're free to move and they can become loose over time if not properly done. In this cartoon, we can just see that the implant is in place. However, over time, bone grows around the implant and it stops moving. That's called an autofusion. If that occurs, it's very similar to a cervical fusion done surgically, and usually the patients still have an excellent outcome. But it's one of the reasons why we don't treat advanced degeneration with cervical disc replacement. Another issue is if the components are improperly or slightly offline or implanted improperly, they can become loose, unstable over time. Some people have more laxity than others and just have a more tendency to develop this type of result. That's called component loosening. If either of these scenarios occur, the implant needs to be removed and then replaced with a anterior cervical discectomy and fusion. In conclusion, cervical disc replacement is an awesome technology that can help preserve normal neck motion. I would always consider a cervical disc replacement over a cervical fusion and an appropriate candidate. Why? Because it allows you to preserve your motion. Usually recovery times are faster. It's just a much more modern technique. However, there are many cases where a CDR will not work. Discuss it with your surgeon and have a conversation about it. If you like this video, you can subscribe. As time allows, I'll make more in the future.